Have you ever noticed how readily we surrender our most profound trusts, especially when it comes to the people who raised us, the ones we cherish most? There's something strange, almost unexamined, about the quiet, automatic deference we extend to the medical system when our aging parents stand at the crossroads of critical health decisions. Most people don't realize that, in our desperate, loving scramble to do everything possible for them, we might, ironically, be steering them away from true peace, towards discomfort, loss of dignity, and even a hastening of the very end we're trying to prevent. Almost nobody talks about this, but what if some of the procedures considered routine, even life-saving in younger individuals, become instruments of subtle harm when applied to the frail and elderly? We often equate more intervention with more love, a tangible demonstration of our care. But what if the most profound act of love means having the courage to say no to procedures that promise longevity but deliver only prolonged suffering? What is love, in its purest form, demands a deeper understanding of what a good life and a gentle ending truly entail, far beyond what any hospital protocol might suggest. This isn't about denying care, it's about discerning it, about recognizing that a different kind of wisdom is needed when our loved ones reach life's quieter chapters. My own journey, watching my parents navigate their golden years, opened my eyes to the often unspoken realities lurking within hospital corridors, realities that push back against our natural instincts and against the pervasive narrative that every possible medical avenue must be explored. We walk into these conversations filled with fear and an overwhelming desire to protect, yet we're often unarmed with the knowledge to question, to gently push back against a system built on preserving life at all costs, sometimes overlooking the quality of that life. This perspective comes not from cynicism, but from a protective heart, from the deeply felt son's promise I made to ensure my parents' comfort and dignity. Let's talk about 5 particular hospital procedures that, in my honest assessment, I would never allow my aging parents to undergo, and why understanding them could fundamentally shift how you approach these delicate decisions for your own loved ones. It's a tough conversation, isn't it? To even think about challenging the very people we trust with our health. We're taught to listen to the doctors, to trust their expertise implicitly. But sometimes, expertise focused solely on physiological markers can inadvertently overshadow the profound human experience, especially as bodies gracefully, or not so gracefully, yield to time. Consider first, aggressive invasive surgery for advanced stage cancer in elderly individuals with significant comorbidities. When a doctor points to a tumor, our immediate primal response is to want it gone. The promise of removing the cancer sounds like victory. And for many, particularly younger, healthier patients, radical surgery is a powerful, life-extending option. But for someone in their late 70s, 80s, or even 90s who already manages heart disease, diabetes, or lung conditions, the calculation shifts dramatically. The human body, particularly an aging one, simply doesn't bounce back from major trauma the way it once did. The ordeal of anesthesia, the significant blood loss, the intensive care unit recovery, the painful incisions, the months of physical therapy, the high risk of complications like pneumonia, infections, blood clots, or even cognitive decline post-surgery. These are not mere footnotes. They become the overwhelming, defining experience of their remaining time. The recovery itself can feel like a new, grueling full-time job. I've seen the unintended consequences. A parent whose final year, perhaps meant for quiet reflection and comfortable moments with family, transforms into a relentless cycle of hospital visits, medication side effects, and debilitating weakness. What often goes unsaid in the optimistic consultation room is that such surgery, in advanced age, may extend life by only a few uncomfortable months while dramatically eroding its quality. The hidden truth here is that survival rates post-surgery can be grim for this population, and the period of survival might be marked by intense pain and dependence. This isn't about giving up. It's about choosing a path that prioritizes peace over further struggle, recognizing that sometimes comfort care, targeted palliative radiation, or chemotherapy designed to manage symptoms rather than cure can offer a far more humane trajectory. It allows for presence, for dignity, for the continuation of everyday life as much as possible, rather than being confined to a hospital bed or a rehabilitation facility struggling to regain what was lost to the surgeon's knife. It's a profound shift in focus, from extending days to enriching them. The second procedure I would approach with immense caution is the placement of a feeding tube for advanced dementia. This is a conversation fraught with deep emotional currents, because to withhold food and drink, even when a body can no longer effectively process it, feels utterly cruel, like starvation. Our nurturing instincts scream against it. However, the reality of advanced dementia means the brain's ability to signal hunger and thirst, to recognize food, and to safely swallow becomes severely compromised. Patients often refuse food, not because they are literally starving, but because their bodies and minds are no longer wired to receive it. Attempting to force feed, or worse, surgically placing a tube, doesn't bring them comfort or nutrition in a meaningful way. Research consistently shows that feeding tubes in advanced dementia do not prolong life, improve nutritional status, prevent aspiration pneumonia, a common concern, or enhance comfort. In fact, they often increase discomfort, necessitating physical restraints to prevent the patient from pulling the tube out, or leading to bed sores, infections, and reduced human interaction because mealtimes are no longer social. The very act of tube feeding removes the comfort of human touch during mealtimes and can replace it with the cold, sterile reality of machines and scheduled administrations. The most loving response when a parent with advanced dementia struggles with eating is often what's called hand feeding. This means offering small, gentle bites of their favorite soft foods, ensuring a calm, loving presence, and focusing on mouth care to keep them comfortable and hydrated with sips of water or moistened swabs. It's a quiet testament to love that understands the limitations, offering presence and gentle comfort over invasive and often ineffective medical intervention. It's about feeding the soul and easing the journey, rather than futilely attempting to sustain a body that is nearing its natural end. Then there's the difficult topic of cardiopulmonary resuscitation, or CPR, for extremely frail elderly individuals, particularly those with multiple chronic illnesses. The images of CPR from television shows, a dramatic few chest compressions, a quick electric shock, and the patient sitting up, coughing, and revived, are deeply misleading. In reality, CPR is a violent procedure. It involves forcefully compressing the chest, often resulting in broken ribs, collapsed lungs, internal bleeding, and irreversible brain damage due to oxygen deprivation. For an otherwise healthy individual suffering a sudden cardiac arrest, CPR can be a miracle. But for a frail 80 or 90-year-old with osteoporosis, severe heart failure, advanced kidney disease, or dementia, the likelihood of a successful resuscitation, defined as surviving to hospital discharge with an acceptable quality of life, plummets to single digits. Even if successful, the person often wakes up in agony, disoriented, tied to machines and facing a prolonged, painful recovery that they are unlikely to endure or benefit from. The decision to pursue a do not resuscitate DNR order isn't about choosing death. It's about choosing dignity in the face of death. It's about respecting the body's natural end, preventing additional suffering at a time when peace is paramount. This isn't about giving up. It's about discerning what genuinely serves their well-being, recognizing that sometimes the greatest act of care is allowing nature to take its course with as much gentleness as possible. It ensures that their final moments, should their heart give out, are spent in peace, surrounded by love, rather than by a team of frantic medics delivering forceful compressions. It's a choice made with immense love, focusing on their comfort and profound human dignity. Another procedure that I've seen do more harm than good for aging parents is excessive, cascading diagnostic testing for vague symptoms without clear, actionable pathways. When an elderly parent presents with general weakness, fatigue, or mild cognitive changes, symptoms that are often just part of the natural aging process or manageable chronic conditions, the reflex can be to embark on an exhaustive battery of tests. Countless blood draws, imaging like CTs and MRIs, biopsies, scopes. Each test often leads to another, a diagnostic cascade that doesn't necessarily unearth a treatable condition, but instead uncovers incidental benign findings, or minor abnormalities that then prompt further invasive investigation. This seemingly thorough approach, though well-intentioned, can be incredibly taxing on an older person. The constant trips to doctors' offices, the discomfort of procedures, the anxiety of waiting for results, the fear of what might be found, and the stress on their already fragile bodies can rapidly diminish their quality of life. Moreover, it can uncover things that are not imminently life-threatening, but then doctors feel compelled to treat them, leading to unnecessary surgeries or medication regimens with side effects that compound existing frailties. The solution is often less medical sleuthing and more holistic care, a focus on symptom management, ensuring good nutrition, gentle exercise, social connection, and thoughtful medication review. This careful approach can truly preserve their vitality rather than having them endure a relentless and often fruitless pursuit of a definitive diagnosis that, even if found, may offer no real benefit in their stage of life. It's about being mindful of their total well-being, not just their symptoms in isolation. Finally, let's consider long-term mechanical ventilation or intensive care unit stays for conditions with a poor prognosis for recovery to independent function. The ICU, for many, is a beacon of hope, a place where advanced technology battles acute, life-threatening crises. And for those with a high probability of recovering their previous quality of life, it is invaluable. However, for a severely compromised elderly parent, perhaps suffering from advanced organ failure, multiple system collapse, or a catastrophic stroke, an extended stay on a ventilator in the ICU often becomes a prolonged period of suffering without the realistic hope of meaningful recovery. They are tied to machines, sedated, often intubated, unable to communicate, surrounded by alarms and the constant bustle of a busy medical environment. This deprives them of human connection, familiar comforts, and their personal environment, isolating them from all that makes life meaningful. The physical and psychological toll of prolonged ICU stays on the elderly is immense, leading to delirium, profound muscle wasting, pressure ulcers, and often what's known as post-intensive care syndrome, a constellation of physical and mental health issues that can persist for years after discharge, assuming discharge even occurs. Often, families, out of love and desperation, insist on everything being done, unaware that everything might mean merely delaying an inevitable outcome, while extracting an unimaginable price in comfort and dignity. The hard, often heartbreaking conversation should focus on defining what a meaningful recovery truly looks like. If returning home, enjoying cherished activities, or communicating clearly isn't a realistic outcome, then redirecting care towards comfort, symptom management, and a peaceful transition, possibly in hospice or palliative care, becomes the ultimate act of compassion. This choice protects their personhood, ensuring their last days or weeks are defined by love, quiet, and cherished moments, rather than by the cold, often harrowing experience of unrelenting medical intervention. It means allowing for a final chapter rich in human connection, free from the confines of tubes and alarms. These are incredibly difficult truths to face, and the emotions that surface when contemplating them are intense. It feels like betrayal, like giving up. But I promise you, this isn't about resignation. It's about a deeply informed, profound act of love and protection. It's about remembering that life isn't solely about extending a heartbeat. It's about safeguarding the essence of who they are, their peace, their dignity, and their connection to us right to the very end. The systems we rely on, however well-meaning, are sometimes ill-equipped to guide us through these nuanced, deeply personal transitions. That's where your voice, your informed choices, and your fierce love become their most vital protection. It requires courage to step outside the dominant narrative, to ask the difficult questions, and to champion comfort and quality of life when others might champion intervention. You are not alone in this journey. This perspective is not a rejection of medicine, but an elevation of humanity within it, recognizing that for our aging parents, the best medicine is often the one that prioritizes their peace, and preserves their dignity above all else. Remember, your heart holds the profound wisdom to navigate these moments, and your unwavering presence is the most powerful comfort they can ever receive. If these insights have resonated with you, and perhaps even eased some of the anxieties you carry, please consider sharing your thoughts in the comments below. Let's build a community where we can openly discuss these crucial, yet often whispered about topics. Your stories and questions enrich this conversation for all of us. And if you'd like more gentle guidance on navigating the complexities of caring for your aging parents with both wisdom and profound love, consider subscribing. It would mean the world to continue these quiet conversations with you. Thank you for listening, for allowing these words into your space. Remember, love always finds its most authentic expression when we dare to truly see and understand the path before us, ensuring peace, dignity, and true compassion for those we hold so dear.